Hello and welcome everybody. My name is Matthew and I'm representing the Academy of Biomimetic Dentistry, and we have a super special guest today, Dr. Takami. How are you, from Japan?
I'm fine, thank you. I'm very happy to have this opportunity to talk with you and this video program.
We are so excited to be able
Mm.
to welcome you in April to do two webinars with us. And we're going to talk about the subject matters here real quick. But I just wanted to ask you, for those who maybe aren't aware of who you are, could you give us a brief description of all that you've done for the field of biomimetics, which is immense?
Mm. Yes, I'm very happy to be given this opportunity because now I'm a head of the Department of Cardiology and Operative Dentistry, and it is recognized as the home of the minimally invasive dentistry.
Wonderful, wonderful. How long have you been practicing biomimetics or studying it and doing research? Because I know it's a long time.
Yes, of course. I graduated from the dental school in 1980. Since that time, I continued the research on adhesive dentistry as well as the minimally invasive caries treatment under the instruction of Professor Takao Fusayama. He is recognized as the father of the adhesive dentistry as well as the minimally invasive dentistry. So that's why the biomimetic dentistry group respect Professor Fusayama very much. So I
because of
was
his,
a student of him. I'm very proud of that.
because of his groundbreaking strategy in adhesive dentistry.
Yes.
Yeah. Well, without further ado, I'd like to say that from all of us here at the Academy of Biomimetic Dentistry and all of our board members and all of our members, we are so excited to have you here because of all of you've done and all the research. We've been lucky enough to have you speak at one of our events that I was at in Dallas a few years ago, and everyone was just blown away with what your subject matter was. So we're just so happy to be able to have you come back. I would like to pull up your the registration page that we're going to be publicizing for everybody, and we're going to just kind of go through that. I'm going to ask a few questions, so if anybody wants to learn more about what it is they're going to learn by coming to this webinar, we can talk about it. Does that sound okay?
Okay.
Perfect. So here is our registration page with Dr. Junji Tagami. As of right now, we're going to be having this webinar held on April 10th, 5 p.m. New York time. Dr. Tagami is also going to be coming back 2 weeks later to do a second webinar, which we'll be promoting after this. But on this one, it's very important to kind of cover what we're going to be talking about. From my understanding, this webinar is going to be all about the removal of caries lesion without pain. Doctor, can you give me a little brief explanation of what that might entail?
In general, the dentist and also most of the patients believe that the caries treatment must be very painful. However, as far as we remove only the outer region of caries, the patient does not feel so much sensitivity. So that's why we don't need to apply the shot of Xylocaine during the excavation and cavity preparation. If we cause the sensitivity to the patient in that during that period, some kind of stimulation occurs to the pulp tissue, and sometimes the pulp tissue does not recover even after the treatment. Unfortunately, sometimes we need to move on to the endo treatment. Once the endo treatment is done to the tooth tend to be broken in the future. So that's why to protect the pulp is very important during the restoration procedures. So that's why I strongly recommend to apply the minimally invasive caries removal in the case of the caries treatment. And this technique was very well established by my teacher, Dr. Takao Fusayama, more than 40 years ago. So that's why I hope you to learn this technique for your clinical activities.
You know, that's a question I was going to ask you. Is there any episode of Dr. Fusayama, who's your
Uh,
teacher, when he tried to develop the caries detecting solution?
yes, Dr. Fusayama often told us that the reason why he started the research on dental caries was that the question from the student, Doctor, which part of dental caries to be removed? At that time, Dr. Fusayama could not answer to that question. So that's why he tried to uh, do research on the dental caries. And in 1970, around 1970, coincidentally, the detecting dye solution was developed. So that's why the dye solution was started to be used at that time. But unfortunately, at that time, there was no adhesive resin materials. That's why even when we had the detecting dye solution, we needed to cut the intact dentin for the retention of the restoration, according to the G.B. Black philosophy. So, but in 1978, we have the adhesive resin material. That's why Professor Fusayama combined the detecting solution as well as the adhesive resin material. That's why he could establish the minimally invasive caries treatment at the time.
In your opinion, do you think Dr. Fusayama was maybe the first person in the, well, all of Japan, but maybe the world to do this, the
Yes,
adhesive dentistry, and identify the?
yes, of course. In, in the past time, there was no adhesive restorative resin materials,
Yeah.
and fortunately, we have the adhesive resin materials. However, the bonding to the tooth was not so easy. So that's why Dr. Fusayama applied the phosphoric acid etching to dentin, not only to enamel. He applied it to both enamel and dentin. And he named that technique as the total etching technique. However, at the time, in 1978, of course, his technique was published in the Journal of Dentistry. However, the Dental Academy in the United States, also the European countries, also in Japan, most of the researchers did not accept it. They criticized it not to etch the dentin. So that's why the dentin etching was not accepted so well. But in the United States, Dr. Ray Bartolotti, he is a core member of the Biomimetic Dentistry.
Yes, he
Um,
is.
yes, he really understood Dr. Fusayama's idea, and he introduced his technique in the United States, and gradually many clinicians as well as the manufacturer try to follow his technique. Nowadays, everybody apply the etching to denti for better bonding.
Let me ask you a question. In Japan, is this specific caries technique excavation recognized as the standard procedure today?
Yes, of course. This is very well educated in the undergraduate education in the field of operative dentistry. And also this part is a very important part in the national board examination. So that's why all the dentists must know this technique very well.
Did Dr. Fusayama really complete the caries removal without a shot of xylocaine?
Yes, of course. Uh, I was so lucky to have given the opportunity to assist his critic when I was the PhD student. And I watched his treatment very closely. And of course, he did not apply the shot of anesthesia. However, after that, when I tried this, my patients sometimes complained about the sensitivity and pain during the excavation. And
Interesting.
I told Dr. Fusayama, so the painless restoration may be a little bit painful. So,
What did he say?
and he said, "Oh, it's because of my poor skill."
There
Yeah,
you go. He
but
blamed he
after
blamed you.
yes, but after that, I really understood the reason why my patient complained about the pain. So that is the so variety of the dentin caries. Of course, age is different, and the activity of the caries region is different. And and after the retirement of my teacher, we did some kind of clinical research to evaluate the sensitivity and pain during the caries excavation. And that study clearly revealed that the elderly patient does not feel so much pain. And the younger patient tend to feel more pain during the caries excavation.
They're
And
more sensitive.
yes, and when I assisted Dr. Fusayama's clinic, he was almost the same as my age of now, mostly 65 years old. And when he continued the clinical activities in the university hospital, most of his patients were very old.
Okay.
Yeah. And I was young student, so that's why my student was much younger than his patient. So that's the difference. So nowadays,
So age plays a part.
yes, age is very important because the size of the pulp chamber is very different each other. So that's why I recommend the clinician uh, the necessity of the Xylocaine. And in the case when the patient feels the sensitivity, when we apply the air blasting before the treatment, if the patient feels sensitivity, of course, any kind of treatment causes pain. That's why we recommend to apply the Xylocaine. Most of the case, people does not feel the sensitivity. That's why we don't need to apply the Xylocaine.
Let me ask you, from the 40 years
Mm.
history of
Yes.
minimally invasive caries treatment in Japan, which
Yes.
is a long time,
Mm.
uh, did you get any suggestions or were you able to improve this technique? And how has this procedure changed since when you learned it?
In the history of 40 years of application of minimally invasive approach, the fundamental procedure had not been changed. However, we always have the question, what should we do in the case of very deep caries region? Uh, Sometimes it is some deep region seems to be very close to the pulp tissue. And in that case, if we strictly follow the staining of the dye solution, sometimes we expose the pulp tissue. So that's why some people don't like to remove all the stain dentin. Is it so? Kuncha asked us, is it possible to remove all the stain dentin or not? Then, of course, Professor Fusayama recommended us the complete removal of the stain dentin at that time. But nowadays, we can we can leave that slightly stained caries dentin, and we can apply the so-called the sealed restoration technique.
Much
And
more conservative.
yes, the sealing is very important in that kind of restoration. And we have a very good reference papers to um, to follow that kind of clinical procedures.
Excellent, doctor. So I don't want to take up too much more of your time, but I would like for our members just to review, or for non-members, I would like everyone to know that this particular webinar where you can learn about removal of caries lesion without pain, which is a highly sought after subject. If you don't know anything about it, you should definitely join us. Just come on over to our website, the Academy of AOBMD.org. And then you'll come to this page. You can learn a little more about it. You might be watching this video right now. And then we are offering CE credit. So if you do want CE credit, you just click on this button right here. And if you do not need or do not want CE credit, no problem. The webinar registration form is right here. And if you put in your information, we will follow up with you with the Zoom information. And once again, this will be on April 10th, United States time at 5 p.m. New York Eastern time. So we look forward to seeing everybody join us. Dr. Tagami, thank you very much for this quick introduction video. I appreciate it. I know your time is valuable, so thank you.
Thank you very much.